let me just say, there are a lot of people in here, and I'm sure Dr. Nguyen will remind you all of how grateful we are to this collaboration. And one of the things I said early on in my administration is that collaboration really does make dreams come true. It's about how we all work together and understand the needs of our community. The reason the Stabilization Center is so important is because what we want to do is change outcomes for people in their lives. And many times, you know, what happens when someone has a drug addiction or is an alcoholic or is suffering in our communities, what oftentimes happens is that they either end up on the streets of our city, you know, they can end up homeless, they can even end up incarcerated. And so we believe that the Stabilization Center will become a model for the country, because this has been in the works for a number of years. But one of the things I said when I first came into the administration is not only would we collaborate, but we would find the right place for this Stabilization Center. Our first location was not acceptable to this administration, but this Stabilization Center, where it will be located, to me, not only provides job and opportunities for people who live in the community, but a safe place for individuals who will be treated. Because in this Stabilization Center, you know that we will be expanding treatment. So when somebody is drug addicted or they're an alcoholic, there's a cry for help. And the question becomes, how do we deal with that problem? It's not something that we can cure overnight. And oftentimes it's something that requires additional services. And when we talk about individuals who end up in our emergency rooms, and in an emergency room, you all know that sometimes people don't get the services that they deserve or need. So the wraparound services that will take place in this center is going to make a difference in the lives of many. I want to thank Pete Hammond, who is on my staff, who worked to help coordinate all of this effort. But I also want to thank Lena Nguyen, because she's a visionary and she's a leader in the health field, noted throughout the nation. And when we first began these discussions around the need for a Stabilization Center, I said, I am in 100%, without a doubt. And it goes without saying to our Lieutenant Governor, we also recognize that this does not happen without funding. So we want to thank the state. Let's give the state a big round of applause. $3.6 million in capital grant dollars to make this happen. And the community, I want to thank the members of the community. Stand up, you all. I want to thank the members of the community. What is great about this community is that it is such a stable community. I don't know if people have had the opportunity to interact with the residents of this community as I have. I represented them as a 4th District City Council person. I represented them as a state senator. And I tell folks that this is probably one of the underinvested neighborhoods that remain stable in our community and deserve investment. Yes. So we say thank you for taking this on, but this is the beginning of the investment that we will make in this part of the city. As you well see, we've cleared land right out in front. And part of what happens here will depend on your conversations with us, with the city, and a continuing conversation with the state. And so we're really excited about the work that's going to take place here. I'm imagining the lives of the individuals who will come through these doors. Because I always say it's when we lift the least, we lift all of us. Yes. And I always say to folks, think about it as if you were thinking about yourself. What would you want? How would you want to be lifted? And I can tell you that our police department's team, homeless team, goes out every single night trying to help individuals to turn their lives around. I've added 6 additional people, and you all saw those headlines. Pew adds all these people to our staff. I tell folks, city doesn't operate city is not 9 to 5. The city is 24 hours. And so that means that we've got to have people out at night, 11 at night to 7 in the morning. We've got to be able to meet the needs of those who are suffering. This will be a 24-hour center. So the question becomes, how do they get here? And so through the help of our police department, through the help of our workers, through the help of the Human Services Department, the additional folks who will be working on our behalf, 24-hour cycle, making sure we direct people, that they don't end up standing in front of neighborhoods and communities, that they don't end up falling down on sidewalks, that they don't end up homeless. Because here, through our stabilization center, we will be providing services, whether it is mental health services, whether it is job opportunities, whether it is drug addiction. This place will be able to refer people and make sure that they get the assistance that they deserve. So without further ado, let me introduce you to what I consider to be the visionary of health care in this country, Dr. Nguyen.
Thank you very much, Madam Mayor, for your vision and for your leadership and for really being the champion for the Stabilization Center from the beginning. I remember we talked about this when you were the state senator, when you first became elected mayor, and I have to say how proud I am of Mayor Catherine Pugh, who is at the forefront of leaders around the country to call for science-based, compassionate treatment of individuals. You recognize that these are individuals who have a disease. They have the disease of addiction. And I'm honored to work for a mayor who is a source of inspiration for all of us. So thank you, Madam Mayor. I joined the mayor in our thanks to the Lieutenant Governor and to all of our state partners. Through leadership of Mayor Pugh and Chief Pete Hammond, Baltimore was able to secure $3.6 million in capital funds from the legislature. For operating expenses, Congress approved the 21st Century Cures Act, and of the $10 million available to the state of Maryland, $2 million is provided by the state to Baltimore. So we thank you, Lieutenant Governor. We thank Director Clay Stamp, Dr. Barbara Bazran, Dr. Howard Howe from the Maryland Department of Health. Thank you very much. An additional support for operating resources comes from the Maryland Community Health Resources Commission in the way of a $600,000 grant, and we thank the commissioners for their support. I also, of course, want to acknowledge the leaders here at Turk House, and so Bernard J.B. Foster, thank you so much. Turk House has stepped up and offered yourself as a pilot seat, as a pilot site, and so thank you so much for your leadership. I know I have a rolling round of thanks, but there are so many who have heeded the mayor's call for collaboration and who are here. And that includes, of course, Chief of Operations Pete Hammond, who is instrumental in developing the concept and securing funding, Chief Niles Ford, Chief of the Baltimore Police Department.
Fire Department.
Oh, sorry, Chief Niles Ford has many jobs. Chief Niles Ford.
No consolidation.
Who is, we're not consolidating, we are thanking Chief Ford for all your incredible work and collaboration with us. Councilman John Bullock, who represents the 9th District, Dr. Gary Rodwell, Executive Director of the Coppin Heights CDC, and all the members here in the community, and Krista Taylor, President and CEO of Behavioral Health System Baltimore. Thank you all. We are in the midst of a national epidemic of overdose and addiction. Here in Baltimore City, over 700 people died last year from overdose, which is 2 of our fellow residents every single day. Addiction is a disease for which treatment exists. And yet, according to the recent Surgeon General's report, only 1 in 10 people with the disease of addiction are able to get the help that they need. For what other disease would we ever find this to be acceptable? I'm an emergency physician, and I've treated thousands of patients with addiction who came to the ER. They know they need help. I know they need help, and every medical provider who sees them know that they need help. Yet the ER is not always the best place to help them. These patients need behavioral health support and social and wraparound services. We providers become frustrated that we can't get our patients the help that they need. And our patients and their family members are frustrated at the inadequacy of our medical system. These are our most vulnerable citizens, as Madam Mayor mentioned. And we would never tell patients with a heart attack, sorry, we can't help you today. Can you wait 3 weeks and be seen then? Why do we do this for the disease of addiction? Here in Baltimore City, under Mayor Pugh's exceptional leadership, we have made progress to treat addiction as the disease that it is. My blanket prescription for the opioid antidote naloxone has enabled every resident in our city to save the lives of over 1,785 people in just the last 2 years. And together with our public safety partners, including the fire department, we responded to the rise in fentanyl deaths by using data to identify hotspots, and then we identify in real time outreach workers to educate and save lives. We know that treating addiction as a crime is unscientific, and we're working on expanding access to on-demand treatment through a hub and spokes model and heeding a call to action by Mayor Pugh. We're partnering with our hospitals to treat addiction just as we would any other illness, diabetes, heart disease, and other chronic diseases. The Stabilization Center is one more step towards on-demand addiction treatment. It will offer a safe place for individuals with addiction to sober and receive short-term medical and social intervention. That includes medical screening and monitoring, connections to behavioral health and social services, and even buprenorphine induction for those eligible to treat opioid addiction. The Stabilization Center is a diversion from the emergency departments. Patients meeting specific criteria will be diverted through EMS transport to the Stabilization Center. This will create a non-traditional access point for individuals with specific behavioral health needs. And this is the beginning of Baltimore's efforts to create a 24/7 ER for addiction and mental health. So I want to take a moment to acknowledge the entire team who have seen the Stabilization Center from the very beginning, the fire department and the dedicated members of EMS service under the leadership of Chief Ford, MIMS and Dr. Rick Alcorda, Dr. Inbill Olson and Amy Knowlton, who championed the concept of the diversion program years ago. And I want to thank one more person as well. I asked this person if she would be okay with my mentioning this, and this is Deputy Commissioner Olivia Farrow. You all know that Olivia has served residents in Baltimore in many capacities. She was the city's first lead paint prosecutor, then the director of the Mayor's Office of Human Service, and then the deputy and acting commissioner at the Health Department. In 2015, when I first started here, I was fortunate to recruit her back to the Health Department, where Olivia has overseen varied priorities, including environmental health, maternal and child well-being, school health, and she is the Health Department's lead on the Stabilization Center work. Olivia has just announced that she'll be retiring from the city after 33 years of service, and I hope you'll join me in thanking Olivia Farrow. Baltimore City, we have incredible leaders under Mayor Pugh's leadership, and we've never taken a backseat to public health. So the Stabilization Center is an evidence-based, innovative step towards treatment on demand. And so thank you, Madam Mayor, for your leadership in fighting this epidemic and treating addiction as the disease that it is. Thank you.
Let's give Dr. Wynn another round of applause. To me, that's leadership, but let me just say this to you all. What she talked about in terms of how we're dealing with addiction, we can't wait to meet with all of the hospitals to talk about their need to really take this on. It is an illness, and we must treat it as such. And the other thing that I'm calling on is telemedicine. You know, I led in the Senate the legislation that required the expansion of telemedicine to urban areas. In today's world of technology, you know, why are we not using telemedicine? And I've read some papers, Dr. Wynn, I'd love to share with you. We've had conversations about this. When we talk about opioid addiction, why are we not using telemedicine so that people can go about their daily lives and not be impacted by having to walk into certain neighborhoods and get treatment that they need? So we look forward to continued conversation, especially with our hospital partners, our scientific partners, our telemedicine partners, about how we improve the outcomes for those who are suffering from drug addiction. So let me now bring to our microphone someone who really understands this problem, who has championed it in the state, who has led the governor to call this a state of emergency, and is providing throughout the state leadership on this effort of drug addiction and how we should be treating it, and has helped to bring forth the dollars that we need in order to stand up this Stabilization Center, none other than Lieutenant Governor Boyd Rutherford. Thank you.
Well, thank you. And good morning. It's great to be here. I should say it's great to be back here.
Yeah, you were just.
Yeah, I was just here, I guess, a couple of months ago. It's all like one long day, so it may have been longer than that. I do want to begin by thanking the mayor and Dr. Wynn for their leadership. Dr. Wynn, I think we talked about a stabilization center maybe 2.5, 3 years ago. We were talking about the concept, and it was talked about in a different part of town, and it's great to see it coming to fruition at this point. I do want to recognize the Behavioral Health System Baltimore team, and of course Turk House for this I would say the temporary site for the Stabilization Center. And of course, Commissioner Elizabeth Chung from the Maryland Community Health Resource Commission, along with our partners at the Department of Health, Dr. Bazran, Dr. Half, who are here with us, and in the Maryland Department, well, Dr. Bazran from the Behavioral Health Administration. Again, thanks for being here, and congratulations really to everyone who's been involved in this making today possible. Just as going back in time a little bit, since day one of our administration coming into office, we have been shining a spotlight on the heroin and opioid issue in our state, and have been using every tool at our disposal to bring heightened level of awareness to this threat that has been tearing apart families and communities all across our state. And every day we've been seeing, from our suburbs to our rural communities to here in our largest city, the impact and the fact that people are experiencing this reality of this addiction and this disease every day. Under Governor Hogan's leadership, we've already committed approximately $500 million to the fight of this heroin and opiate epidemic. And that includes the $2 million in operating money that we put into the Stabilization Center here. But we all know that it's going to take a collaborative, long-term, multifaceted effort to address this problem as it continues to evolve and escalate, particularly with the introduction of fentanyl into the communities. So this is about helping people help themselves. It's about healing families and strengthening our community, and the bottom line is saving lives. We must remain steadfast in our resolve to work together, recognizing that this crisis really requires an all-hands-on-deck approach. And our administration has been tackling this issue, this concern, from multiple directions, from prevention and education to enforcement and expansion of treatment, as well as recovery efforts. And that is exactly why I'm so pleased to be here today. By taking the steps like this, where the state is working together with behavioral health systems of Baltimore, as well as the Baltimore Health Department, we're providing services to those in need of immediate help that will help them link them to the treatment and other community-based resources that they need. Through this collaborative effort, we are expanding treatment options available in our state. As the first of its kind in Maryland, this Stabilization Center will help us connect those in need of treatment and resources to the recovery, or at least starting that recovery process so they can restart their lives. We are very hopeful that this effort will serve as a model for the state that we can replicate in other parts of Maryland. So thank you again, and please know that we are committed to fighting alongside the city and all others as we continue to combat this crisis. And from all of us, again, it's about saving lives. And thank you again.
I wanted to take a moment to acknowledge Councilman John Bullock, who's here with us. Councilman, thank you for being here with us. You know, I was asked a question yesterday, and I just want to remind you all, all of this contributes to the violence that our city is experiencing. But I want you to know, and Dr. Wynn is a part of this, I said back in October, for those of you who don't know, we're one of 32 cities in the world that are part of the Bloomberg cities. And we've received $5 million to help us in terms of our technology upgrades for our police department. But what most folks don't know is that not only are we under a federal consent decree, but we're required to reform our police department. So I said in one of my Bloomberg classes, what would it be like if all of my agencies, including the health department, came together with my command staff? Would that help us in terms of violence reduction in our city? And I can tell you that in my first meeting, I was told by the commanders the response time was 7 to 14 days. Today, it's 1.52 days. And what has happened is, and we don't brag early, right, Dr. Wynn? You know, our first month, we experienced a violence reduction in November. In December, we experienced a violence reduction. In January, we experienced a violence reduction. February and in March, we're still experiencing a violence reduction of nearly 30% in every single category. I share that with you because one of the things that Dr. Wynn talked about here was collaboration. And this is the collaboration of a lot of groups and organizations. But when we talk about the problems that the city faces, and someone asked me yesterday, Greta Van Sant, I think that's how I say her name, who came to interview me, and she said to me, how do you stop crime? And I said, you know, it really takes us looking back at how this country began, and then how we've written our Constitution, and how we've not readdressed it. And if you think about a criminal justice system that has been unjust for decades, when you think about the mass incarceration of African American males, and you think about the high unemployment rate, and you think about people who are incarcerated, and then you come out, you go in because you have to pay a debt to society. You come out, you've paid a debt to society, but there's no integration back into society. In fact, we deny you basic services, whether it is food stamps or your identification. And one of the things that we did do together, Dr. Wynn, was that we required the state, and we did this, Lieutenant Governor, to provide 45 days of medication for folks who were on medication leaving prison. But that's not enough. And when you look at the drug trade that we are facing every day on our streets, it's almost like we've created this culture that says you can make more doing this because your society has not welcomed you back. I tell folks violence is absolutely not the way, but our cities, our state, our country must find a way to integrate people back into our communities and provide them with the services that they need in order to become whole. And that's part of what this Stabilization Center will do. The question becomes, what leads to alcoholism? What leads to drug addiction? And these are the problems that are underlining in terms of mental health and all the issues that people are facing because we've not become a welcoming society as we claim to be. I remind people that the Statue of Liberty says, bring me, you're hungry, you're tired, you're poor. And this society, this city, this state, this country must recognize its role in terms of how we treat the least of us, because it's how we treat the least of us that will allow us all to move forward. So I want to thank everybody for being here, and more importantly, I look forward to when we dig that shovel, open those doors, and we're looking forward to the pilot project. Again, I want to thank Turk House and everyone who's here in the community, and more importantly, Dr. Wynn, for understanding what it is to propose a vision and then to see it to fruition. Thank you so much. Thank you all.